All right. Well, welcome everybody. I'm Dr. Bob Brakey, head of our IHA Lifestyle Medicine Division, and we are in our 7th year now of Quadruple Aim Workgroup. As many of you have joined us over the years, you know that we rotate
I remember
four
that.
Quadruple Aims. Somebody needs to mute. And those include Don Berwick's charge for healthcare systems to incorporate population health initiatives, enhance the experience of care and caring for the providers, and lower per capita cost. Today we are on the population health aim, and this is the one that's probably least understood. It's easy to kind of see how we're going to enhance experience of care, how we're going to make things better for people with their experience, how we're going to lower costs. Not easy to how, but it's easy to understand. But population health is a bit more nebulous and incorporates areas including enhancing wellness, improving the efficiency and effectiveness of care, enhancing our ability for workflows and to bring tools to the trade to help us, and enhancing community resources, because we can't do this all on our own if our real goal is to improve the health status of the communities we serve. So this, again, probably one of the more challenging of goals, and one which we take very seriously within our health system and within IHA. So we're very fortunate to have a long-term expert in this field who has roots in the area here. One of my early mentors from medical school, residency, and early years of practice. And I'd like to invite Meera Agarwal to introduce our distinguished guest tonight. One other thing, again, please mute yourself if you're not speaking. We will have time for discussion later, and you can use either the chat box or being able to turn on your video and ask questions directly. I'm going to push mute all because somebody's still giving us some feedback. I'll turn it over to you, Meera, and you can unmute yourself and move on.
Hi, everybody. Can you hear me? You can hear me now?
Yes.
Okay,
Yep.
perfect.
Yes.
So it is my pleasure to introduce Dr. Eddie Erlandson. I promised I would keep this short. I will try my best. So I originally met Eddie through my husband, who was doing his surgical residency. So the both of us were residents back in the 90s at St. Joe's, and I think we have most of the gang back here this evening. And I always remember Eddie being a phenomenal surgeon, but what I remember best really about him was his kindness and his generosity. He used to have an annual get-together for all the residents and their families at his beautiful home. He had lots of acreage and a lovely farm, and we would come. I had a little boy, which was very unusual back then since we were both interns, and not only did he find it perfectly acceptable, but he helped literally take care of him. I have this wonderful memory of him helping me clean up his mess one day. But not only that, Eddie, of course, would be the only one that anyone would know who would have a full-size Native American teepee on his property. And so he would take Arjun with him into that, and they would discuss how they needed to be in there because Arjun was an Indian, and they would have a great old time. So, but that was back then, and then we lost touch, and it was just a very coincidental happenstance how we reconnected through a mutual friend and colleague who was researching coaching, and the famous Eddie Erlandson's name came up once again. And so I managed to track him down, and he very kindly agreed to do this talk. I hope you've all read his phenomenal bio, because not everybody has such an incredible life journey. And not only has he had it, but he's willing to share it with us. So going from the pinnacle of a surgical career with chief of staff, leaving everything, walking away to discover himself, discover that he can help others still in the non-medical world, and now has come full circle back to continue teaching us again with all of his wonderful words of wisdom. So I would like to invite Dr. Eddie Erlandson to please speak. Thank you.
Thank you, Meera. Well, I feel like I'm home. I really do. And that's an unusual circumstance at this stage in life, but I'm home because people like you and Mac are here with me. And that's one of my themes that I'd like to put in today, but I feel like I'm at home because things do come full circle. My first re-entry conversation with Mira, I started asking about things, particularly things that I had been involved with before I left. And I was incredibly grateful and gratified to find out that many of the things are still going on. Now, I was also not so happy to find out some of the same challenges and frustrations are still going on as well. But I want to start with a level of appreciation for St. Joe's, for the past staff at St. Joe's, for the current staff at St. Joe's, and know that for those of you that are here today, many of you actually were not born when I left. But it's nice to talk with you anyway, because I want to have this to be a conversation. So many people now ask me, how did you happen to have so many careers? And my answer now is I only have one career. I had a career of being a physician. And I still have a career of being a physician. It's just that there were different stages along the way. And one of the themes I want you all to take away and remember is that it's not a straight track anymore. Maybe it was back in the older days where you basically decided you were going to go to medical school, you were going to do a certain residency, you were going to get a certain job, and you were going to stay in that job come hell or high water. And if you thought about doing something different, you usually got a fair amount of feedback that you just got to buckle down, Eddie. You just got to keep doing this because this is what you were made to do. So I want to let you know that I'm happy to believe now that you don't have to stay in the same realm of contribution in medicine or in healthcare. The second theme I want to have today is that starting way back when, I found that there was something called awareness. Awareness. It was an interesting concept. I thought it was sort of psychological, and surgeons don't think very highly of psychological things. But awareness turned out to be a strategy and a skill that underpins, in my opinion, regardless of all the different things I've done, all of the effectiveness. So, Bob or Mira, can you put that first slide up there?
Sure, let me pull it up for you. Can you see it?
Not yet. There it is. Okay, that's very nice. Okay. I think I can even make it a little bit bigger here now. So while I was thinking about this particular talk, I wanted to name it something. And it really, the title of this talk is Life Lessons because it's personal and it's professional. And I'm so happy that Frank Smith has joined us today because it was a number of years ago, actually 1994, when the relatively freshly minted Michigan Heart and Vascular Institute, with Frank at the helm and Jane Bocci at the helm, decided that we should do something in the prevention and health of cardiovascular disease, not in that wonderful commercially effective model of treating cardiovascular disease. So this is how it started. It started as a program called Life Lessons. But the life lessons that I want to spend time with you today having a conversation about is the lesson of awareness, of commitment, and of the skills, because our effectiveness as physicians, whether it be in lifestyle medicine or in population health, is based on helping other people grow and change. But others can't grow and change unless we grow and change. That was a bit of an epiphany for me. So let me say that again. We can't effectively help other people grow and change unless we grow and change at the same time. And we didn't think about that so much. We were delivering healthcare. I'm trying to slip the slide up. Next one, Bob. So my question to you starting out now is, how are you doing on growing and changing as you've been in your professional career? And are you growing and changing in your professional life, and are you growing and changing in your personal life? So that's going to be the theme here today. If you can flip that next slide so I can see it, Mom, that would be great. I'm going to enable editing, slideshow. I can't get anything to show here.
Can you see the next slide? Join my personal journey.
No, I can't. There we go. So let me just, this is a conversation not about me or my journey. This is a conversation that I'm hopefully is going to stimulate you and your journey, wherever you are, whether you're early in the journey or whether you're midway in the journey or whether you even feel like you're a long ways along in the journey. So what I've said many times about particularly the Life Lessons program, if no one had shown up, I would have gained immensely, because the one thing that we founded that program on was what's called a mindfulness-based, that is awareness-based health and wellness program. And as that program progressed, and if we'll talk about the program a little bit more later, it became clear to me that I had some learning to do out of the program. The second thing I want to share with you, which is quite personal, is that I realized in the awareness that came out of that program and my practice with my incredibly supportive colleague and friend, Mac Whitehouse, that I was rowing a boat really hard to be an effective leader. But in some ways I had it tied to the dock. Rowing the boat really hard, but it's tied to the dock. And so my question for you today is, are you rowing the boat really hard and in some ways tied to the dock? Now, what does that mean? We all start out with a full level of awareness. We really do. We're born with awareness. Arjun had awareness when I met him out at the farm. Okay. And then sequentially, we cover up our awareness abilities with our identities, with our habits, with the life path that somebody tells us we're supposed to do, and we actually set out on it, with the belief system that we arrive on. And most of it's a good thing, but some of it actually doesn't enhance our awareness. It actually dampens our awareness. And somewhere down the line, we wake up one morning and say, is this it? What have I missed? And that's what I really want to bring out today in our talk, is not only are you thinking about what you missed, but what are you going to do about it? So let's put the next slide up. Have we got
Life
that?
Lessons. Sorry, did it advance to Life Lessons?
No, I wanted to be on the number of slide that says well-being assessment, and the one before that's called the classic medical model.
There we go.
The slides are gone, Bob.
Thank you. Sorry. My personal journey. There we go. Classic medical model.
Yep.
I think you have to reshare.
Yeah.
Yeah, I'm sorry I'm not able to share them directly, but it's okay. We'll make this work.
Is that showing now?
No.
No.
Well, let me continue my conversation with you on this. So the first thing that I want to highlight is the idea that awareness is the key factor to growth and change. The second is that awareness gets dampened over time. And the third one is right here, is that actually growth and change does not fit into the classic medical model. Let me say this again. Growth and change, whether we're helping other people do it, like our patients, or ourselves, does not fit into the classic medical model. Classic medical model, we gather data, sometimes very quickly, because we have to do it within the 7 minutes. We then interpret that data through a what's wrong or pathologic lens. We then immediately go to being the prescriber or the fixer and see whether it's working. So the classic medical model is disease and illness focused. It turns out by no intention of our own to be fairly hierarchical. That is, one up, one down. I'm telling the patients what they need to do. I'm not asking, but I'm telling with gentleness and kindness. And then we hope they're going to do something with it. And if life is threatening enough or the disease is threatening enough, they do something with it. But I want to say that if we're going to get into the wellness change, we have to do it something differently. So I want to go back to my practice of 20 years and plus with Mac and I practicing around vascular disease. We chose vascular disease because I think it was fairly well circumscribed. Yes, we liked the treatments. We knew the treatments. We were actually enjoyed doing some of the treatments, particularly the surgical ones. And we, along the way, recognized that this disease, arterial sclerosis or sludge, was something beyond bad habits, bad genes, and bad luck. Something beyond that. And it's something that we learned from about the 5% of our patients. That is, that some of them actually changed their lives. And when they changed their lives, something happened that was sort of miraculous. And sometimes the disease didn't go away, but it stayed stable. And I got fascinated with that particular part of the disease. How could we enhance that 3 to 5% that actually looked at how they were meeting their life and change it? But what I want to bring out today is physicians are embedded unconsciously and consciously in the classic medical model, not only about our patients, but about ourselves. So we tend to pathologically look at ourselves in terms of our effectiveness, good, bad, right, wrong, effective, not effective. But the alternative here that I want to suggest to you, and this may seem radical because coaching and development for growth and change in a positive direction does not fit that model. The prevention does not fit the classic medical model. Primary prevention is you get rid of the things that cause illness and disease. But the real changes that 5 to 10% of our vascular surgery patients did had nothing to do with that. It was a change related to their ability to be reflective, ruthlessly honest with themselves about their life and what they were doing with it, how they were meeting change, how it was operating inside their family, how it was even operating in their interaction with us as care providers. How could we engage a conversation rather than a telling? Could it be an asking? Could we actually become partners with these patients? And what I realized is we had to do the same thing for ourselves. We had to become more reflective, more curious, less judgmental about ourselves, to be able to be really partners with people on this wellness and well-being pathway, prevention pathway. We couldn't depart from the classic medical model, but we needed to enhance the classic medical model. So go to that next slide, Bob, if you can. Perfect. So I want to stop for a minute, and although I can't see you and I can't hear you, I want to ask you to do something. And I know that it's been a long day. Many of you have been working at real jobs really hard. This may seem a little light at the end of the day. But here's what I'd like you to do in the next just 2-3 minutes. I'm going to give you some time here. I want you to rate your current professional satisfaction on a scale of 1 to 10. We're not going to ask you what it is. 1 is low and 10 is high. That means that if I say 1, it means my professional satisfaction is down near the bottom. If I say 10, it couldn't get much better. How's it working? And if you put a rating that's somewhere in the middle, I want you in parentheses behind that, if you're taking notes, say, what level of professional satisfaction am I committed to getting to? Am I committed to getting to? And you say, well, why wouldn't it always be a 10? And I'd say, well, at some level, your current rating is what you've been committed to. You might be willing to take that up a notch if you're willing to be a little courageous, a little introspective, but that's the first question I want you to answer right now. And that doesn't take long. So what is my current personal satisfaction level? So one of the things that people often ask me is, how do I choose a coach? Or how do I choose a doctor? How do I choose a population health doctor or a lifestyle medicine doctor? And I answer, find one whose life is working, who's continuing to grow and change. That doesn't mean they don't have problems, but it looks like they're taking a degree of engagement and accountability. So scale of 1 to 10. 1 is my current personal satisfaction is almost 0. That would be a 1. Or it's really great, would be a 10. And again, what level of current personal satisfaction would you like to get to? And if it sounds overly reflective, that's my intention. And in some ways, at a certain point along the way, and I can remember almost the week or the day, I had to ask these questions. Because I had to go to the next piece. Where do I lose energy and impact, either professionally or personally? Where do I lose it? And then where can I find joy and fulfillment? So there's one other rating I'd like you to do. I'd like you to rate yourself on personal daily reflection. One of the things we learned in the Life Lessons program, which I'll talk about here in a minute, was that the people who benefited long-term were those who had some daily anchor practice that continued to keep their awareness high, even if it was painful. So where do I lose the energy and impact? Where do I find joy and satisfaction? And let's go to the next slide. And I'm breathing for you because when you ask these kind of questions, sometimes you sort of stop breathing. So let's talk about life lessons. Frank, I am incredibly grateful to you and to Jane and to all those people who supported this particular program. Life Lessons, we called it this. We called it a mindfulness-based integrated health and wellness program. And actually, because we had this going, somebody made me the director of wellness for a period of time. Well, that was very generous, but I didn't think that I was actually fully well. Okay. It took all the programs, all the components that were standalones: diet, nutrition, exercise and fitness, stress and stress management, mindfulness awareness techniques like yoga and meditation. And then we put it together with this thing called connectedness, which wasn't just connectedness with each other. It was connectedness with our families. It was connectedness with ourselves. And we did it for 16 weeks in a row. And actually, Mac was one of the graduates of that particular program. Now, there were a few people who rolled their eyes about this program. But I will always be grateful to this program because out of it, I came to see that this was what made me a even better person, but also a better doctor if I really embraced this. And so I'll always be thankful for life lessons. I'm also thankful for the fact that I believe that many of the components of this are now living in what's a much more formal way, particularly in lifestyle medicine, but possibly in population health as well. Let's go to the next slide, Bob, please.
Sorry, it seems to delay each time.
Yeah, I know. But that may be good. It allows us to take a breath or two.
Executive coaching.
Okay, so what happened next? It turns out that in our different ways, two of us who were the co-directors of LifeLessons ended up moving into coaching. Jane did it more directly. She actually got some coaching certification. I basically kind of backed into it, but found the lifeline of my life, which happened to be my relationship now, my long-term marriage for 20 years with Kay Ludeman. And I basically moved into executive coaching and leadership consulting with a little company that Kate had founded 8 or 10 years before called Worth Ethic. A tongue twister a bit, but you could get the idea. Worth Ethic. Now, this was an interesting move because, first of all, I knew nothing about coaching. But I was working with one of the best coaches in the country as my trainer, and I did some formal coach training. And Kate identified that physicians, at least the ones she knew, me, had an interesting polarity in them. They were incredibly good at picking up things, noticing things. I could get out of a history in 5 minutes what she said it took her an hour to get from a CEO or an executive. I thought that was kind of nice. Of course, we knew nothing to do with it, what to do with it. But I immersed myself for the next 20 years in executive coaching. And how did I do it? Well, I did it by realizing, first of all, that my own profession liked me to come and give keynote addresses, but they really weren't ready for the rigor and the ruthlessness of this kind of coaching. But they got there, okay? We used a coaching model that was based on the 360 assessment. That is, we gathered feedback from a lot of people, sometimes 30, 40, 50 people who worked around a person, and we put it together in a feedback report that we then spent 1 or 2 days going through with them and developing what is it they want to change. Now, this is where I didn't notice something that I now notice. In the non-healthcare world of executives, there was a degree of openness to feedback that was different from what I have now found in healthcare and in physicians. Yeah, they could take it personally. Yeah, they were very defensive. Yes, they had a lot of hubris. Yes, they were know-it-alls, just like us doctors. But they still said, well, this is interesting. I think I'll do something about it, because they did not see feedback through the medical model, the classic medical model. They saw feedback as something that could, in their cases, enhance their financial productivity, which is what they were all about. So I was lucky enough to work with Kate, and we wrote 2 books. I always say she wrote them, and she put my name on the first one, called Radical Change, Radical Results. And then the one that the Harvard Business Review article led to, called Coaching the Alpha Male. Is there anything unique about this? I think we're good coaches, but in my case, the takeaway from the practice, from working with Mac and Hugh and Frank, and getting into LifeLessons became the foundation for this, because I now got even more committed to the idea that awareness was the move. So I'm going to put it out here right now. Awareness is a skill set, and it's a commitment. And in my belief, which I now will take into telling you about what I've been doing for the last 10 years or so at the Dell Medical School, my belief is that this is the foundation of effectiveness in our practices, in our coaching, and very honestly, in our leadership. It's the foundation, it's the foundational skill. And very honestly, it's not for the weak of heart at times. So let's go to the next slide. Things started to come back from healthcare to me, which I was grateful about. And after meeting the inaugural head of the brand new Dell Medical School at the University of Texas in Austin on a bike ride, he asked me to become his coach and to become involved with what we call a very unique and innovative curriculum, both undergraduate curriculum and graduate medical curriculum at Dell Med. And this became another opportunity to flex this. But I want to say right off the bat that after 5 years of doing it, I felt like I wasn't being as effective in coaching, particularly doctors, as I was not doctors. And I got intrigued by that because I wanted to say, well, you know, doctors are know-it-alls and they have a lot of hubris too, but that's not the problem. The problem is I do believe that we still tend to look at ourselves and each other and maybe at our patients always through a medical disease and illness lens. And I'm just wondering if we can shift that. And I started over the last 3 or 4 years to try and shift it in the undergraduate leadership curriculum. But it's really funny. The disease and illness model seems to be in medical students before they come to medical school. So they tend to pathologize things, which is great if you're in the emergency room or on the trauma service, and even when there's acute illness. But if you want people to grow and change in healthy ways, you have to do something more or different than that. And that's the theme that I want to have today. So go to the next slide. We'll talk about what we actually did there. So this was a Dell Med Visions. Wanted to create practitioners and leaders of the future. And as you can tell, I have a particular belief that the mindset and the behavior set of practitioners and leaders of the future needs to be a little bit different from the past. We wanted to build new partnerships with technology in the commercial sector to meet patients' needs. We're getting there. But number 3, we wanted to develop a self-awareness and a commitment that creates a lifetime of learners and a lifetime of leaders, but also a lifetime of effective healthcare practitioners. That's the real challenge. That's the real opportunity. In some ways, you'd say we want to put ourselves out of a job. Now, we're never going to put ourselves out of a job of treating illness and disease, but we also wanted to make our patients partners in their own health going forward and encourage that as best we could. See, LifeLessons was really interesting because most of the people who came to LifeLessons had some reason for being there. Hypertension, coronary bypasses already, cancer, and so on. And the percentage in LifeLessons that actually engaged and changed their lives was very encouraging to us. But I also had to look at myself. I had to hold up the mirror and say, what am I going to change? And by the time I got to Dell Med, I feel happy to say that that has particularly happened. Now, I wouldn't be doing you a favor if I gave a talk and didn't talk about the strategies. So I want to talk about the strategies that are built on a commitment to ongoing awareness that will allow us to partner with our patients, with their families, and with each other, and with ourselves to be even more effective. And it's all about growing and learning, some degree of curiosity, but also a ruthless vulnerability to what you're not doing that gets in the way. So the next slide. After a while, after a little over 1,000 360 and coaching adventures, I decided that I could simplify effectiveness, whether it be in healthcare, in leaders, or in physicians taking care of patients on a day-by-day basis, into 3 areas of effectiveness that you could work with somebody on. The first was, what is your day job? What does your day life look like? How can you make things more functional? Intersecting with that is, how can you be even more effective with people, through people? And sometimes the people included yourself. And then this other one that I actually ended up in coaching getting paid highly for, because nobody wanted to give anybody feedback on it. Is there something about your style that is lessening your effectiveness or increasing your effectiveness? So we brought awareness and some methodologies of awareness into 3 intersecting areas of effectiveness and impact toward growth and change, because it's dynamic. Now the next slide. So, coaching and leadership in healthcare. And I'm always including our patients in here. And I'm also including ourselves in here, which I was so grateful that you added that 4th arm, that care of the healthcare giver. Okay. So we needed some continuous mindset challenges and investigations. We needed to look at the medical model versus the change and growth model. And can we, this is my question to you, because I'm not doing it with you anymore, but there is a population health department at the University of Texas in Austin, bringing coaching to lifestyle medicine and population health. How would we do that? And we do it by trying to get out of our own way. Trying to get out of our own way and uncover the things that have been covering up our fullest awareness, like our identities, like our habits, like some ways our unconscious beliefs about what it's supposed to be a physician. And I think you're already kind of adding to this in your own minds here, as you are clearly becoming, I believe, reflective as we talk through this. So let's talk about the first strategy. Feedback agility. And again, let me ask you a question. How agile are you with feedback? And I'll get more specific if we can get that slide up there so people can see. So most of us get up on any one morning and say, I'm really going to be open to feedback today. Okay, I'm really going to be open to feedback today. And within about the first 15 minutes of the day, when we answer the first email or look at the first email or walk into the office, if we can ever get back into the office, we actually go resistant to feedback. We go into our usual form of some justifying, explaining, rebutting. So the first side of the loop of feedback agility is, how can we enhance our receptivity to feedback? How can we invite people even more to give us feedback by not being defensive and justifying? What do we know about our feedback agility on the receptivity side? And as you know, that you're all in some ways smirking, vascular surgeons, maybe surgeons in general, aren't known for this. They give feedback, right? They don't take feedback. And in some ways, with our patients, we actually give feedback. We don't take feedback. You can't, and then we say to ourselves, well, you can't actually be very receptive to feedback for your patients if you only have a few minutes. I don't know. So let's talk about the other side. Are you able to deliver feedback in a way that it lands? Can you take 100%, not 120% responsibility? Can you take 100% responsibility for how the feedback lands? Can you customize it? Can you look at your effectiveness and own your responsibility for this particular feedback? Can we do it with our patients? Can we do it with each other? And most of all, can we also be feedback and agile in our own minds? Now, there's something very interesting that happens that I call the dynamics of feedback agility, where it hits the ground. And that's in the next slide. So feedback agility actually falls into a few patterns. Here's one of them. If you have something important to say to each other, to patients, to your family, to your kids, to your wife, your spouse, the bottom of effectiveness of giving feedback is connect, connect, connect. But we don't have time to connect. We have a lot of important things to tell people. So we jump over the connect, 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 which allows us to get our brains in sync, and we go to convey, convey. Let me tell you what I think. But worse than that, particularly if we feel strongly that we are in the right, we go immediately to convince. And that may work at times, but it doesn't usually work over a period of time. If you go past connect, even past convey with your patients or with your peers here in healthcare or lifestyle medicine or population health and convince, usually you will get that glassy-eyed look after a while where people just start avoiding the conversation with you. So let's go to that next slide. The 3 C's of effectiveness and influence. Build relationships, show your understanding, develop shared goals. Consistently listen to ensure the other person feels heard. Not that you can reiterate or summarize what they said, but did they feel heard? Can you become agile in receiving feedback as well as giving it? Because nobody's going to receive your feedback if you aren't showing yourself as being feedback receptive. Your patients don't think that they can talk to you. They won't actually take much that you're giving to them. And then can you actually, when you do get to it, can you tailor your approach to what their life looks like, whether it be a peer or a patient? Now the next slide. Now I want to really jump in here, and I know I'm on maybe thin ice with you here, but I want to talk about the other thing that I think gets in the way of awareness and gets in the way of our effectiveness as physicians. This is what I found out about myself at times early on, and maybe still yet. Because particularly as I came back to healthcare, even with all the strategies of coaching I learned in non-healthcare, I slipped into being a doctor again. And that meant I slipped into the doctor identities that I had. So I call them our physician styles and identities. If you want to use a term, we call them personas. They're software packages that we actually have been running since we were about 3 years old. They came into existence because they were needed, and yet we forgot that they were there, and we think it's just us. So there are various mindsets or beliefs. They cluster into styles and identities that we automatically slip into, like getting dressed in a dark closet in the morning. They were helpful earlier in life, and maybe even at times later in the life. But as these things start to escalate unconsciously, they invite other people's personas. For example, I don't know if you've ever been in any meetings like this where somebody walks into the room and everybody says, well, Eddie's here now, you know what that means. That means that the persona arrived before you did. And of course, you already had a reaction to it. So this whole idea of becoming more aware of our styles and identities, almost even ruthlessly, or if somebody identifies one, are you receptive to the feedback that they're giving you about how this may or may not add to your greater effectiveness? Or do you go into justifying and explaining things? Let's go to the next one, because I want to show you two that I think are very common in physician personas. These are the personas that keep you stuck while you're pedaling hard, but you're tied to the dock. I had a number of these. The first one that I want to identify is hyper-focused, what it means to be a physician. This one wasn't on my list even 3 or 4 years ago, but it's like we get locked into a path of our career and an identity of our career, and then we kind of track along on it, not even thinking about, does it really make sense to us? You get very hyper-focused. Or you have a mentor who you respect a lot, who tells you what you should be hyper-focused on. I had a few of these. Mac was not one of them. Mac was somebody who said, it's interesting how you're thinking about things. So I just want to hold that out. So there's a second one here on this list that I think is very common to physicians. And unfortunately, I think that after many years of being gone from St. Joe's, it still lives there. It's called martyr. And we have, if there's a martyr, it means there's somebody who we're a victim of, and I'll talk about that in a second. But martyr and hyper-focused. And then, of course, we have our usual ones. Know-it-all. Or we have some other ones. But I just wanted to think for a minute. Stop at this slide if you can, and if you've printed it out or if you want to write it down, what is your most obscuring, retarding persona of your effectiveness with your patients, with your peers? What is it? Just choose one. It's nothing wrong with it. Remember, we're trying to get out of the pathologizing disease and illness model and just be curious here. Do you have one? Most of us can immediately go to one. Skeptic is also very common. Okay. So please, if you're willing, write this down or just hold it in your mind for a second, because I want to do something with it. Next slide. Okay. This is an interesting strategy where if you're willing to own a persona or a pattern or a habit, and if you can't come up with the one, you might ask somebody close to you what your favorite least effective persona is, but you don't have to do that now. I want you to interview it. So you can take hyper-focus, you can take martyr, you can take healthcare helper. You can take even gifted surgeon. And I want you to say, when did that persona first make its appearance in your life? We're not face-to-face, we can't interact. I'm not going to interview you like I have done with people in offsites like this, but when did you first show up in Eddie Erlandson's life or Hugh Solomon's life? When did you first show up? Second question. Who did you learn your style from? Well, usually there's an answer that comes and be, oh, I learned my style from, and it's usually somebody who was close to you at some point in your life. You didn't think you were picking that up, but you did. And then I want you to acknowledge how did it help you in the past? So I think we all know how hyper-focus, gunners, pre-meds, focused in helping us get through undergrad, medical school, residencies. And what are you most proud of out of it? Because there's a lot to be proud of some of these personas. But here's the quill. where does this persona make you most anxious? So I had a persona that I will just share with you right now that I came out of the fact that for many, many years in practice, in a vascular surgery practice, I was needed, not wanted. I was needed by my patients. And when I first moved out of being a surgeon and being a practicing physician, I had a coach who said, Eddie, would you be willing to be wanted, not needed anymore? So, God, what does that look like? Because I had a persona of being liked, of being affirmed. I got my affirmation of my worth and value as a person outside of myself. And so I had to move back inside. Some folks, in fact, I think this is how I got elected chief of staff one time, had a lot of charisma. It was about it. It was kind of empty. But this is internal charisma we're working on here. And then in this persona, how are you keeping it going right now? How are you keeping it going? And then what do you want right now? And when you can find out what you really want, are there new ways other than this particular habitual pattern to do it differently? Would you be willing to try something different from know-it-all that would make you feel like you had worth and value in your practice and with your patients or with your peers? Would you be willing to move into that new place? Now, not to rush you through this, because I want you to have this to play with this a little bit more. Let's go to the next slide, please, Bob. Now, this dynamic gets even worse, okay? Or better, if you want to put it that way. It's been described by Stephen Karpman many years ago and further developed by my mentors, Gay and Katie Hendricks, of what's called the triangle. And some people call it the dreaded drama triangle. That's being a little melodramatic to me. But our personas allow us to slip into one of three positions in the dreaded drama triangle. And trust me, none of these positions are any better than another. They all sap our creativity, and they also dampen our awareness. Personas and the triangle that they go into sap our creativity, our problem-solving ability, our awareness is dampened when we step into these. So the three positions are victim, villain, and fixer or rescuer. Okay. The victim is the blameless one. They're at the effect of, okay. They're even at the effect of Trinity and IHA and St. Joe Hospital and each other. But nobody wants to stay in the victim mindset because everybody wants to say, well, I'm really a helper. I'm a good one. And we go over there for a while. And we always have we have this game playing all the time. If you show the next slide, I'll show you where some of these personas show up in this energy sucking dynamic of the triangle. Victims, accommodator, complainer, conflict avoider, innocent bystander, there's martyr. Misunderstood, overwhelmed is one of my favorite ones. I actually think that in the first 6 weeks that I was sitting in the chief of staff's office and had an endless succession of doctors who I really respected and were great doctors in some ways coming in my office. They all came in with complaints. They were even complaining about the number of patients they had. Then the second one, Action Jackson, blamer, broken record, debater, know-it-all, rebutter. And then we have the third, which is no better than any of the others, but I lived between victim and rescuer, cheerleader, evangelist, nice guy, peacemaker, pleaser. So I want to come back to the fact that there is no position in the triangle that's any better than the other, and we rotate around this game. So if you're going to be a victim, there's got to be somebody who's the villain. If you're going to be the villain, there's somebody that you got to hassle that's not stepping up to their job. Rescuers spend a lifetime trying to smooth things over between victims and villains until they give up. You say, God, I've tried to help these people get along with each other, and then you become a victim or you become a villain. Okay? So next slide. Okay. Here's how it works. We can play around with this, but think for a minute, since we aren't together, I want you to think about how your position, starting from maybe the unconscious persona that shows up, starts the game of the triangle going. And I would expect that you start thinking right now in your practice, in your department, in your galaxy, maybe even in your life, where are the triangles? Where are you losing and giving up awareness and creativity by being in the triangle? And now let's go to the next slide, because here's the last piece of this that I learned along the way. We actually do the triangle drama in our own mind. In other words, we actually go into mindset of, oh my God, I don't think I can stand another day of this. These people are trying to kill me. Don't they understand how hard it is to see this many patients in a day? Okay. But we don't want to have that come out of our mouth because we don't want to be a complainer. So you say, come on, Eddie, shape up here. You're smarter than that. You can. So we villainize ourselves. You just had a little more maturity, or now we're using, if you had a little more resiliency, a useless word, by the way. And then we do a little rescue move on ourselves. Now, in my case, I did rescue moves by going out for a run with Hugh Solomon. But we also do it by eating ice cream, maybe having an extra glass of wine and so on. But the game just goes on, and it's exhausting. It's exhausting. Next slide. Well, I'm not interested anymore in even staying in the triangle. How do we get out? How do we get out of the triangle? So the first thing to get out of the triangle is to recognize that you're in there. And oh, by the way, if you think somebody else is in the triangle, you've been there already yourself, because you've just gone into playing the game. So the first thing is, can you get out of the triangle by enhancing your awareness? Can you step away and watch yourself at the same time you're slipping into criticizing or complaining or rescuing? What would that be like? Can you basically say, this is interesting. Rather than going into defensive or critical of yourself or other people, can you get even more curious? Wow, that's interesting. Can you own it? Can you own that? Rather than wishing that the world or somebody else would change. And the best way to get out and stay out of the triangle is actually to enhance your awareness muscle and your commitment to keeping and making clear agreements and speaking candidly with people that you have an issue with. So there may be more that you could add to this list, but the most important thing is recognize you're in this kind of dreaded energy suck. And then you get out of it. And I know we'll talk about this because we're going to have a good time to answer some questions, and I can almost feel some ways the skepticism. That's okay. And I can also feel the sobering aspect of some of this as we look at our effectiveness with each other and with our patients. But let's go to the next slide. So exercise 3. Here's what I'd like you to write down now. How open are you to learning and changing from the inside out, rather than the endless belief that if somebody else or some situation changed, it would be all solved and better? What personas and habits are holding you back? If you were committed to making a change in either your style or your mindset or your behavior or whatever term you'd like to use for it, what would the change look like? And don't go too far. We're at point A. What would point B look like? And are you willing to take that first step in the next 24 hours? Because whatever you commit to under that third bullet, you'll be tested on in the next 24 hours. In some ways, that's how change and growth works, but that's also how we stop growing and changing. It's also how change works with our patients and with each other. But it's also what keeps us from changing. And the next slide. So I often am happy that I'm at a stage in life where I can say, what are you committed to today? Well, I don't care what stage or what place you are in your journey, but what do you know about what makes your heart sing? For a long time, we knew what made our heads sing. Okay? What makes your heart sing? That's the thing that you would do it for free. You feel more energized when you're doing it than you were before you started. Are you practicing some of the strategies that do make your heart sing? If not, what holds you back? What holds you back? That you have 100% control over. What is holding you back? And if you made a move, what would it be? It's incredible how many people are standing by, beside you, in front of you, behind you, that will help with that move. And you can help them with the move as well, whether they be patients or family or whatever it might be. And of course, I get very challenging. What's the first step you can take in the next 3 days? So I want to add one thing in here. There's a number of references that many of you maybe already know, but there's one called 3 Vital Questions. And here's the 3 vital questions that I did not include in this slide deck. Where are you placing your focus right now? Are you reacting to problems that trigger your anxiety, or are you creating outcomes that matter to you? How are you relating? Now let me use the term relating to yourself. How reflective are you? Do you have a daily practice that enhances your reflectiveness? And then of course, I've already asked the question, what actions are you willing to take? So let's go to the last slide, and then I really do want this to be a conversation. I feel like I've way talked too long here. So I've been lucky. I was lucky because I had a wonderful partner, Mac, and friends like Hugh. I was lucky because I had a chance to practice at a place like St. Joe's. But very honestly, you can say, well, it was better back then. No, it's good now. So I've had intersecting paths as a physician, then moving into healthcare leadership as a coach and consultant. But really, it came down to I've had the path of increasing awareness and maintaining effectiveness, which is what I believe growth and change is all about. So I leave this to you, and I would love to have your comments and your views, but this is the place I always like to use is 3 words. Compared to myself back then, I feel like I'm far more humble, far more mindful, but as you can tell probably in this presentation, equally determined. So with that, Bob, I think I'm going to stop.
Perfect. Thank you so much, Eddie. You are a master at helping us to understand what can bring greater levels of success and fulfillment in life. So thank you so much. People at this point should feel free to either raise your hand or type questions in the chat box. Eddie, I guess I'll start. I remember the last time I saw you before we met again virtually was your last HVPA board meeting. I was chair of the Primary Care Council, and I was on the board, and you were moving on in your career to this newfound, what has now unfolded as a highly successful coaching career. And your main point there was similar to what you're making now, and that is everybody talks about efficiency, everybody talks about satisfaction, but it's about effectiveness, because from that, the others follow. And I want to kind of key on that piece as you've talked about effectiveness. Do you mean that in a clinical or a approach to your life goals, or all of the above? How do you mean by effectiveness as it relates to population health?
Yeah, so it's a really good question that has come to my mind and actually come up from people. What is effectiveness? Well, the question is, what are you rating effectiveness on? In other words, are you reflective and aware enough to decide what effectiveness looks like in your life, or in your work, or in your practice, or in the role that you have? I don't know what effectiveness is at this point in time for you, but I truly believe that with the God-given awareness that you have and the intellect that you have, and if you're ruthless enough to strip away some of the things that are getting in the way of even your awareness, you will know what effectiveness is. Now, if you're brave enough, you can go ask people. You can say, here's what I'm looking at as my effectiveness in this role of, running IHA, for example. And they may or may not tell you, depending how daunted they are by the question. But that's where you can actually get feedback agreements for people and then use them. So I love the idea of effectiveness and impact, by the way, and the fact that most of us are only slightly aware of how effective or ineffective we might be, but we're more aware than we actually give ourselves credit for.
Great, thank you. Melissa, do you want to turn on your microphone and your video?
So Dr. Erlandson, hold on.
There you are. Oh, hi, Melissa.
Right there?
Yes,
I had switched over to my phone just so my dogs weren't going to be bothering us. So I wish we had the pleasure to have known each other. I joined Trinity and IHA after being around the block for a while, and I really loved so many of your points that you had to make. I've been internal medicine, been in practice for 23 years, and I had a huge wake-up call, I think, shifting my paradigm of what I've been taught in the regular medical model when I was at the University of Michigan and did a year-long faculty scholars program with Rita Ben in integrative medicine, and spent an entire year learning about alternative ways of healing. And coming through a traditional, I'm a DO, so I learned a little bit more holistically, but pretty much conventional. And really just made me be curious, like you said. I was curious. It went from that medical model of I thought, everything I knew exactly how to be a doctor. And then I went on to do professional training in mind-body medicine with James Gordon. And his professional training is experiential. So for 7 days, I was in the trenches of doing this. And I think that as we're trained as physicians to follow that model, we never really have to live it ourselves, right? And be self-reflective and create that awareness. And so when I went through that training, it really shifted my whole way I practice medicine. Mm-hmm. And I think that's such an important aspect that, I feel blessed that 12 years ago, I was able to come through that. And really learning that vulnerability is not a weakness. And I think that as physicians and caretakers, we always feel we have to fix people, right? And so therefore we have to be strong and we cannot be vulnerable. And really it's becoming authentic and aware. So I'm with Bob and Mira with the Lifestyle Medicine Institute. And the other point that I really loved that you said was you want to choose a doctor who seems to be doing this themselves. And I think that those of us who have selected lifestyle medicine, we've had a passion for this and a draw to this because we not only believe in it, but we practice it ourselves. And in order to really give that information to our patients, we feel we have to live those pillars, or else we're being, hypocrites. So with that being said, and I just love everything that you have to say. How do we translate this into a functional piece of medicine where productivity may go down because this takes time, this takes investment. We need to be reflective ourselves, and with RVUs and primary care model, what kind of advice do you have that we can make this sustainable? And really, what you're saying is the effectiveness, right? And I would love to hear your thoughts about that.
Yeah, let me start with a couple of things. One, I really want to acknowledge the level of self-awareness and the commitment to bringing a different model to your own personal practice, and I would guess, just like me, to your life. Okay, so here's my first response: is in your own mind and with each other, because you've mentioned some other people that you practice here with in lifestyle medicine. See if you can help each other, support each other to stay out of the triangle. Can you also develop feedback agreements with each other? Anytime, any way, any topic, I'd like your feedback. And then if somebody comes to you with feedback, say, you have to make it not only sound like it, but you actually have to accept it, not agree with it, but basically take it in. So this is what I meant about the triangle. To me, is a dynamic and an ergonomic phenomenon where we get ourselves out of our best awareness, out of our best creativity, because we actually unconsciously slip in there. And this is, staying out of the triangle is like flying an airplane, okay? You're never totally out. You're always slipping back in. So you need a little bit help from the autopilot, which can be your colleagues if you have this commitment together, to basically stay out of that zone. And even at that, you're going to do it. And then when you do it, can you own it? So, that last conversation we had, I had a really crappy day, and I'm getting tired of RVUs and 7-minute visits and somebody kind of looking over my shoulder. I kind of went into a way of thinking that I don't think enhanced my effectiveness, or maybe even my effectiveness with you, whether you're talking to Bob or Mira or anybody else. And you just take that in for a second, and then I think you'll be surprised. What you want to do is you want to put some air back into your life sometimes. You want to take a breath. And of course, that I didn't really mention it, but I started a meditation practice in 1984 when my life wasn't working. It was through the meditation practice, the formal meditation practice, that I recognized that I was rowing real hard with my boat tied to the dock. Okay, so there is a real value to having a daily, whether you call it mindfulness or centering or some type of practice that helps you watch yourself non-judgmentally. You see, physicians, the illness model, we watch ourselves judgmentally. And that is not going to be helpful in moving you or somebody else forward. So in some ways, my answer sounds a bit too conceptual. But on the other hand, because it's been experiential for me, I would just encourage you to try it out, because you have in this room, on this call, even on the screen, you have people who can be fellow travelers with you. Not rescuers, not mentors, not advisors, not uninvited fixers, but fellow travelers. And I think we need that in healthcare. We really need that. Our life will be working. Thanks.
Thank you.
Eddie, what Melissa didn't mention, she just qualified for her 10th marathon, a Boston Marathon. And she does her meditation, I think, out on the open field in any weather.
That's what I mean, you're now going one past me. I think, of course, Mac will tell you how many times I left for a Boston Marathon and he had to pick up the practice. But that was both a strategy of enhanced awareness for me, the obsessive exercise, most of you know, but it was also a defense. And I own that. I mean, and I'm trying to stay away from that. So if if Stuart's on the line and we're going to go bike riding together, I'm not going to go mindless biking with him.
I can help with that.
Go ahead, Stuart, turn on your video. You can't let that one go without comment.
Eddie and I had exchanged some plans to bike together. We follow each other on Strava, as do the Solomons. So as long as you gave me the the floor, I guess I'll reflect through my lens. In my current part of my career, most of the people on the call know that I've been devoting my time to coaching providers in the exam room, you know, in how they communicate with patients. And there's a lot that Eddie has provided today that if you just pare it down a little bit and define the situation, can have some real impact. And there's lots of overlap to what we talk about and interact with and try to chat about in our workshops that Eddie has brought here. Clearly, so much more that Eddie provides about self-reflection, but it does have some relevance to how we deal with our patients, obviously.
Yeah, so since I know Stuart pretty well, I'll ask you, could you share with us what your most least effective persona was or is as a physician?
Oh boy.
I don't want to put you on the spot, but I do want to
unkind.
put us all on the spot because this is, I think the persona identification and the persona interview may be the most powerful thing that I have offered you today. It took me a long time to be willing to bring it into coaching, and particularly to bring it into healthcare coaching, because everybody took it so personally, as if I was a psychologist giving them a diagnosis, and I'm not. But I just wondered whether you, because I can name about a dozen really positive personas you've had over the years in healthcare at St. Joe's and even in my own life. So do you have one that you were struggling with here, if you want to go there?
Well, I do have to admit I did a screenshot of that exercise about the personas. So I'm going to do some reflection. I'm not sure if I.
Okay. Well, I'll ask you again at about 25 miles on our bike ride.
And get stuck there a lot of the time.
Okay. Thanks, Sue.
Additional questions, thoughts, comments? Mac, your name has come up several times during his talk. Where are you? Turn on your video and share some words of wisdom and reflection on Eddie's talk.
Can you see me?
Yes.
Okay. Well, I always feel relatively inadequate when I listen to Eddie speak because there's so much more that I could do. He asked what Stuart's least productive persona was, and one of my least productive personas was a bully in the operating room. Now, I wasn't known for that, but if you crossed me, I could be ugly and a bully. And there are sometimes I reflect on my practice, and those are some of the times that I feel least proud of my contributions.
Well, I want to say something about Mac and I feel incredibly grateful to have that kind of partnership for as many years as Mac and I had. And what I will tell you was whenever I got in trouble, which was fairly often compared to when Mac got in trouble, we would call the other person and say, would you call Dr. Whitehouse and have him come over? Now, I didn't say, would you call the bully to come over? Because there are cases where you really want to step into, that is a productive persona in a certain situation, because it's also balanced by your incredible kind and patient persona that you brought to patients and their families, and even to the staff in the operating room. So I want you to see this as an awareness and balancing act. So I wouldn't have it any other way.
Right, great.
And
Mira.
just to clarify, Eddie, you're talking about being in clinical trouble. You weren't talking about having done something wrong. You were talking about needing another set of hands, I think,
Well, no, Matt, we've known each other a long time. You helped me in all of those areas.
Yeah, okay.
You never bailed me out of jail, though.
Sounds good. Mac, thank you for sharing and your timeless wisdom as well, and for joining us tonight. Mira, you've obviously done a lot of thinking about these topics, known Eddie for a long time. What were your
So I think it was a fabulous talk. It's not often you hear a surgeon have a discussion like this, so it's very remarkable. It's almost like an out-of-body experience, right? Like, who's this person and what's the talk about? And I'm sure there's people thinking, you know, who maybe don't know you as well. But I have to say, like, it's been kind of parceled out. Like, I knew Eddie, you know, 20 some years ago, as I said, during residency, and, you know, briefly met intermittently when Finton and I came back for the collar meeting. And like I said, just like always very charming and kind and caring in an otherwise very harsh world. I'm just still kind of wrapping this all around my head, because I think that there are so many steps to all of this. You know, we all train in a certain way, like you said, and we become leaders in our own manner. And that requires sometimes making choices that you may not want, even if you know, want to empathize more or feel, you know, that you could present yourself in a different way. And sometimes I think it's nice to have a discussion like this to remind ourselves that perhaps it doesn't have to be so top down, you know. Melissa, I think, was touching on the fact that we have to kind of keep the machine going and try to make sure that, you know, in order for us to survive, we have like the checks and balances, and we keep the money coming in, but we also want to keep our patients happy. We want to keep each other happy and survive this journey. I think that one of the greatest blessings of being a physician is that you get the opportunity to step into so many people's lives. And I realized that some time ago that not everybody does. And I always remind myself that I can learn so much from my patients. Doesn't matter who they are, you know, if I like them or don't like them, you have that opportunity to reflect afterwards. And there's always that chance to learn and grow. And I think it's nice as we evolve as a unit and as like medical group, that vulnerability is okay, and that it's not looked upon as a weakness and it's not trodden upon. But so I think we need more people like you who, and like you said to me once, that, you know, having that hat of having been the chief of staff vascular surgeon gives you that empowerment as you walk in the door to be able to speak this way as well. So there is that piece to it too. But just fantastic thought. I think a lot of time for reflection. It would be really nice to follow this up, I think, with another one in 6 months or a year to see if people have kind of processed this and if people's attitudes and approaches to their workday and their personal life have changed at all. So thank you.
Mira, really, so when Mira and I really started to connect, and she started to say, would you be willing to give me a little career counseling? I said, well, I'm always happy to give unsolicited advice, but what is it that we're looking for here? And I really learned very quickly that Mira is very feedback agile on the receptivity side. And she's also embodies all the physician personas that we talked about, like explaining and justifying and so on. And I was, you know, as kind as direct as I could be with this. But I think this is a place where I'd like to use your comments to say, would you make a commitment based on this talk to something? So I usually do something at the end is that up until now, and you write in something that you know has lessened your effectiveness, either yourself or with other people or as members of a team. And then the follow-up statement is going forward, and you write what you're committed to. And you share it with a trusted group of people that you want to be close to. And you hold each other not accountable in a negative, pejorative way, but you basically hold each other accountable. and moving forward in a supportive way. So I call this the simplest form of coaching you can develop. It's called peer coaching. Peer coaching. It means that if I'm going to have a peer coaching relationship with Bob, for example, I ask him to give me 3 questions he'd like me to ask him every couple weeks. I don't come up with the questions. Bob comes up with the questions because these are questions that will support and enhance his awareness. And I will ask him to ask me these 3 questions. Okay, and we commit to that as a peer coaching partner. There's no advice in it. There's no judgment in it. There's just, you could call this the tickler file. You know, I'm going to be the Jiminy Cricket sitting on Bob's shoulder, and he's going to be his own Jiminy Cricket, and vice versa. So this is a place where you can formalize this to some degree. And yeah, those questions might change. You might want to have one question in the functional bucket. You might want to have one question in the people bucket. You might want to have one question in the style bucket. And then you refresh them periodically. So think about that as how you can take this wonderful thing that I'm so happy to see, this, you know, this group that you have, and put it together in a way that gives it some scaffolding, gives it some legs.
That's very interesting. Thank you. I think we work really well as a team because we do bounce ideas off of each other. You know, we don't just jump into something. But yeah, this is certainly one step further.
Perfect. So on Saturday, I was out on the boat. It was a nice hot day. And here comes this text from Hugh Solomon. He's like, Bob, I hear, I'm trying to do his accent. I hear Eddie Erlandson is coming and I want to see him. We go way back, you know. So Hugh, your name has come up a lot here too. Slip on your video and give us a few words of wisdom or comment on Eddie's talk and where you see us going in the population health sphere.
Boy, you know, I always try to detract. Eddie and I go back a long time. In fact, I think we interviewed at St. Joe's. They always had an interview when you came on, one after the other. We were there at the same time, and we followed a lot together. Eddie, this talk is a ton to swallow, and we have sat and chatted about all this stuff. We've been on bike rides discussing all of this. It's very difficult to swallow and assimilate all of this easily. I think awareness, and you and I have gone into this awareness in depth. Eddie took care of me. Eddie has always been the guy to take care of people who have problems, and I had significant problems in the early 90s. I'll tell you a story that we met in the surgeon's lounge one day. And I said, Eddie, I've got a problem. And he said, what's the problem? I said, you know, my protein and creatinine is swapped. My creatinine is higher than my protein. And he gave me Deepak Chopra's book, which started getting me on a course of awareness. And I went out and learned how to meditate. I've been vegetarian ever since, etc. And we've interfaced over the years many times. I find it's a way of life, but it's very difficult to incorporate all of this stuff in the hustle bustle of busy practice, lots of external pressures. It's very hard to, Eddie, sit back and say, now, wait a minute, where's my awareness here? You know, when you're in the middle of something, when you're calling Matt Whitehouse to come and get you out of some deep hole, where's my awareness? You know, so I understand what you're saying. It's incorporating a lot of this into your everyday living. And what I found the most useful actually is the early morning meditation, when I sit and try and come to one. I come inside myself a little bit and see where I am. But I find it very hard.
Well, let me ask you, let me say one thing and then ask you another question. So, as you know, for as many years as I've known you, I have seen the person sitting beside you as your greatest partner and supporter in your effectiveness and your awareness of life. And I know you've used Annie. So I want to thank her for that. Okay. And as much as I identify with your evangelism and your enthusiasm, I also know that there's a downside of that persona that, you over-engage on things at times, and probably to your own deficit. But here's my question to you. If it weren't hard to take all this in, what would you be doing? If you'd say, if 3 months from now, if you said, this isn't as hard as I said it was, what would have happened between now and 3 months from now for you to see awareness, mindful awareness, in a different way? That's what I ask myself a lot of times, because that's how we get there. The idea that something is hard is very familiar to us as physicians, family of origins. This hard thing, it was built into us. Seems like we were born with it, but we weren't really. So if it weren't hard 3 months from now, what would you have done in the meantime?
Eddie, it's not so much the goal, it's the journey that one is on.
That's right.
The being, we are so goal oriented. Let's get there. Where are we getting to? Let's rather travel and enjoy what we're traveling on. And that's what I try and do. As you've always said, let's live in the moment. It's not trying to get there. It's trying to find out.
It is all about the journey. And I feel so grateful to have friends go back and our present friends like you, Hugh. So just got to swap out the I for the we.
You got it. You got it. This has been wonderful. This is just,
well, let's see.
A wonderful hour and a lot to reflect on.
I'll see you in your living room in a couple of weeks. So.
You got it.
Great.
One last thing. Yes, I've had an analysis for 49 years, and it continues every day. There's my self-awareness, hopefully.
Yeah. Perfect.
For letting me come as well. I really appreciate it.
Oh, thank you, Annie.
It's
Thank you.
very, very good.
So feel free to raise your hand, turn on your video, ask a question, make a comment from the field. While they're formulating their questions, I'll ask another one, Eddie. As we think about this from a perspective of population health, there's a scene in the documentary Escape Fire where the cardiologist from Cleveland Clinic says, I can spend 10 minutes putting in a catheter and get paid $1,400, or I can spend 45 minutes counseling a patient how not to need a cardiac stent and get paid $45. She said, it's completely irrational that we have a system that incentivizes high-tech things that are of marginal effectiveness, so to speak, and don't focus on the fact that 80+% of the diseases we see in our offices and hospital every day are largely preventable and commonly reversible with some straightforward lifestyle metrics. And this is partly why I see you, in your career as saying, I've got to move upstream a little and make a bigger difference than just an artery at a time that's going to reclog if this person continues to eat the way they do. Comments on that?
Yeah, so this is very familiar to me, and a lot of people think that that's why I left and stayed out of traditional medicine. But it's not really the case. I truly believe that creativity, growth, and change happens if we can stay out of that dreaded triangle that takes us out of the best portion of our mind. Is it going to happen overnight? No. Is this a reality that things do have to change in the healthcare system? I don't have any idea how it's going to happen. What I don't want to lose is you or Mira or anybody, Melissa's effectiveness with any one patient or with each other because of that. And because, you want to sort of say, I don't know how this magic is going to occur. It sure looks like there's no end in sight for this system that we have because, why wouldn't you choose that? I think the one thing that I tried to do for a long time after I came through an integrative medicine fellowship and so on, and it was we've got to figure out a way to not beat them, but match them at their own game. And that's what we're trying to do at Dell Med, is we come up with a healthcare financing system that encompasses, doesn't replace what we're doing, but it actually, and we find.
Oh, we lost him.
I think we lost him. Oh, no.
Yeah. Must have hit the button. Let me let him know that he's lost here. And Frank, I think you had a comment, or if you want to come on while we're working to get Eddie back on.
Sure, I'd be happy to do that, but I wanted to ask Eddie some questions too. So I will wait. I will hold my tongue.
Do you want to share some fun memories of the two of you with your life lessons while we wait for him?
Mac and Stu and Hugh are still here, and so it was a unique time. And I don't want to sound like an old. Oh, there we go. He's coming in now. I'll share the memories shortly here.
Okay.
I think I'm back now.
You're back. You disappeared.
So I was just talking about the model that we're trying to put,
Yeah.
where basically we create a system that, and hopefully find some payers, big payers, like Tesla or the University of Texas or Amazon or or Whole Foods, that are willing to pay for the comprehensive model as a package deal rather than a fee-for-service deal. This fee-for-service model, I can see how it got there. We actually, as physicians, can sometimes let it get there, but we've got to figure out a way to create a hybrid, not an alternative. I don't think we're ever going to get to be able to have an alternative. We've got to create a hybrid. And there's Frank, and I bet you he knows exactly how to do this.
Well, Eddie, I don't know how to do it as well as you do, but it's so nice to see you and hear you again. And, you're picking up, well, actually continuing right where you left off back in 1995. I just want the other people to know how far ahead Eddie and you mentioned Jane Bocci were in terms of this type of approach to medicine. Bob just a few moments ago said that we need to move more upstream, and I couldn't echo that more as a cardiologist who thought my original goal in life was to open as many stenoses and put in as many stents as I possibly could. But like so many of you in practice, they keep coming back with the same problem. So your leadership there, which was 25 years ahead of the time, has really resonated. And finally, some people are beginning to show that they recognize this. In 2010, they approved what's called intensive cardiac rehab, and in 2017, they made people with peripheral vascular disease eligible for that. So it's coming. How do we get there? I think you said it. I think we get through awareness. We get through it through awareness. We get through the second corollary is we don't just try to complement what the basic fix-it practice is doing. We show that our way is better. Our way is superior. Our way has better outcomes, and not just medical outcomes, but quality of life outcomes as well. And you're doing that with what you're doing at your institution at I guess it's University of Texas at Austin, I guess, and at the Dell Medical School. And I want to also compliment Mira and Melissa and Bob, because they are, I don't know whether they're precisely emulating that or not. We'd have to get into more detail, but they're certainly headed in that same direction with resident education and faculty education and enhancement. And I see a lot of light on the horizon that I didn't see 5 years ago, and that I certainly didn't see back in 1995. I have a helper too. She's blurred in the background.
I see her now.
Come up here a little bit.
Hi, Eddie. Nice
I haven't
to see
seen her in a
you.
long time, but it's great.
Missed you.
Yeah. So whatever Anne's doing for Hugh, she's doing for me. Same issues. same health.
This is a real challenge as to how can we be persistent. This is what I call determined, and do the things that can get, that we do have control over. I truly believe we're going to get to the hybrid model that's not either or, that it's an and. I'm not sure it's going to be our generation. It certainly won't be Frank, mine, and Mac's generation, but Mira and Bob, you may be the ones that can kind of get this going, but it will take a little bit of courage.
I think actually, Eddie, I think we're closer than we think. I think I'm very optimistic. It's almost an exponential curve. There's a little bit of movement in the late 1990s, as you well know. Some movement in the 2000. Since 2015, at least, this curve is accelerating. I think largely due to people like you and Bob and Mira and Melissa and all the others. And I'm a bit more optimistic.
Thank you very much, Frank. Appreciate what you did for my life.
Okay. And yours for mine.
It's great seeing you all. When I started on staff at St. Joe's in 1985, you were the kind of just ahead of me kind of founding fathers generation of the can-do, kind of make it happen folks. So to see you all back together now in a time when, as Frank said, I think it's quite exciting times because we are changing. We can no longer afford the current paradigm. Alzheimer's alone threatens to bankrupt our society if we don't do something differently for prevention and true care, let alone diabetes, heart disease. So thank you again, Eddie, for being an early pioneer in that field and inspiring people like me and others to follow this pathway.
Are there other questions? I appreciate all the positive things. Are there any skeptics out there? Are there any people who are having a little trouble with this? Because we welcome that as well, because we're all partners on a journey. I can tell you, I was at a certain stage, I was born an asshole and a skeptic, and hopefully I've moved beyond some of that. So, but I know that I'd like to, see if there's anything that's getting in the way here. Now, this may be the group that's talking to the choir here, but we don't live in an environment where we're all in the choir, and we have to figure out ways to be effective with the naysayers, the skeptics. So can we bring kindness, but also persistence? And that's the goal here.
So Eddie, it's been, it was interesting. You had said a while ago to us that we should, Mira and I, maybe should listen to John Kabat-Zinn with his wherever you go, there you are. And I actually listened to it twice. Mira and I listened to it together, and I thought, guarantee you missed a bunch. And I've been very much a skeptic on this stuff, and I'm becoming a convert. But I thought the most, there were two interesting things. One's a comment about, he made a comment when he's talking about it. He said, when you listen to this series of tapes, and I thought, when the hell did he write this? And it was back in 1994, and I'm assuming you probably read it right. You probably had a first edition somewhere in there since you started this stuff in 95. But the other sort of really most important thing that he talks about is probably on the first page or first two pages about how everything that you've done before this is a reflection of what got you here, and it's all done. And we've no idea what's happening next, and the only thing you can deal with is right now. And I look at your posts about all the different roles that you play or personas that we have, and I can recognize myself in each of those spots at different times. And just having listened to this, I'm not good at meditating. I'm not good at getting up earlier in the morning. I'm not good at that. And just taking multiple times during the day to try and stop and say, okay, just think about where you are right now. And if I can do it for 30 seconds or a minute, I think I'm starting something. But it's he talks about doing 45 minutes was what his coaching recommendations were. But if you get whatever you can do is an achievement. But Yeah, I'm very much a skeptic, but I thought that one point really resonated, that you can only deal with right now. Stop and think about what you're at right now and where you can take it, and we'll see where we go.
Yeah, thank you for that. I mean, yes, John Kabat-Zinn was a key part of our Life Lessons program. Actually, I went to spend a week learning about his mindfulness-based program, which was really beginning at that time. One thing that I would say is that, and you mentioned it, we're here now. Okay. All of our distress, stress, and strain is because we wish it were back then, or we are leaning toward the future pretty hard. So how can we step into each day being in the present moment, non-judgmentally, which is his definition of mindfulness and mindful awareness? And whether you embrace formal strategies or not, it's very possible. The other thing that I've found is that it's actually contagious. When you live in the present moment, it's interesting. Not everybody, but people will sort of step into the present moment with you. And so I do think John has been an incredible person. He's the one person who's not sold out to making a lot of money. The Tony Robbins, the Deepak Chopras of the world sort of sold out. But John Kabat-Zinn has stayed steady. I'll never forget the look on Mac's face when I told him I was going to do a 2-week silent retreat at the Insight Meditation Society, but that was a foundational piece. I often say I got the physical fitness foundation from running all those marathons and all those miles, but this foundational piece is even more solid than that one.
Perfect. Additional thoughts?
Can I add something, Bob? You are my friends, all of you, and my colleagues. If in any way you would like to share with me or with each other your up until now and going forward personal commitments, and if any way I could support or join you in those, I'd be honored to do that. It's just something that means that much to me, particularly from St. Joe's and from this group, because I do think we can create our own groundswell, if you want to call it that, where we can create the momentum, even in southern Michigan or across Michigan. But we need to think about the value of doing it together. And so if there's any way I can be a part of that with you, not be your coach or advisor, but to basically explore with you, is what I call my coaching model, is exploration. And then you get to decide where you're going to take it and what you're going to double down on.
That's great. That's very generous of you to offer to continue to coach us collectively and individually as part of your family. And we too welcome you back to our clique. Are you, you're in Traverse City now, so you're not even that far away. Once we get back to in person, maybe we'll have you down for
Oh, well, that's good. I'm up here sitting on the edges of Duck Lake outside of Interlochen, Michigan, and we'll be here until the second week in October, and then we do have a home outside of Santa Barbara now, so we'll be going back there. But as a true extrovert, and I am, video just doesn't do it. But I would love to reconnect, and I have lots of friends and family down there.
Yeah, that'd be great. Just about 2 months ago, I was down in Austin, and we rented a boat, a captain, and he pointed out Elon Musk's house and Drew Barrymore's house and Eddie Erlandson's house, right there on Lake Austin, and told us how famous all these people were. And so your connection down there and your help at Dell is obviously become very influential.
It's very interesting. It's you mentioned the people who I'd always like to ask the question, are you doing what makes your heart sing? And how is your life working? And every other week we get some snippet of news about how somebody's life is not working in spite of some of the successes that they have. So I'll take this group any day.
Perfect. All right. Anybody else who's been back so far to jump in, ask a question or give a comment? All right, Eddie, I guess you get the last word then. Any summary, or where do we go from here with the comments?
Well, it's interesting that I really appreciated that Frank said I hadn't changed much, that I had the same message. I feel like the message has gone deeper for me. And I am incredibly energized, as you might be able to tell, by bringing the message out. But the proof is in the pudding. In other words, the effectiveness even of this talk or this presentation is going to be measured in what you do, not what I said or even the content of it, because I do believe that most people on this call were on a personal journey that sort of joined mine along the way, but I would love to see that personal journey continues. So that's where the money is in that personal space. And in any way that we can share it together, both the steep hills and the deep valleys, I'm very happy to do that. And I, again, so grateful. This was a completion I told Mac I didn't think I'd ever have. And maybe it isn't a completion, maybe it's just a continuation and we've come back home.
Perfect. Well, once again, thank you so much. Your connection with our community, your timeless wisdom, your experience of the ages. I would agree that in some ways you haven't changed much, and in other ways you've obviously grown so much from the life experiences that you've had, and have helped to shape your ability to help others to improve their lives, their chances for success in whatever they look forward to achieving.
So I acknowledged the rock of my life and how much it changed me, and that's my wonderful wife and fellow traveler Kay Ludeman. So it's been an incredible wind under my wings at a lot of stages, and she is the big part of it here. She's the coach. I'm kind of the learner. So thanks.
Perfect.
Okay.
Well,
thank you so much, Eddie.
Here. Thank you again. And we'll be in touch again soon. Thanks everybody for joining us. Have a great rest of the summer, and we'll see you in October for our next Quadruple Aim work group. Remember, Lifestyle Medicine Interest Group meetings still occur monthly. We're going to take August off, but we've got some great sessions coming up in July, and we will look forward to seeing you all there.
Okay.
Thanks, Eddie.
Bye.
Thank you. Thank you.
Eddie.
Good night.
Thanks, Eddie.
Bye-bye.
Thanks, Eddie.